Naitwa Lucy Rafael Gulinja, ni Mrs. Danstan Hospital Onyango, natokea Tanzania, Dar es Salaam, na hapa nipo India, Bangalore, katika hospitali ya Apollo kwa ajili ya matibabu.
Mrs. Lucy Rafael Gulinja is my Mrs. My name is Danstan Hospital from Dar es Salaam, Tanzania. My wife had a breast cancer problem, and the problem started in 2020. We had some treatment in Tanzania where they discovered that the problem was a breast cancer. So what followed was breast cancer operation there, and then she was treated also through chemotherapy and radiotherapy. That was 2020 as per doctor's advice, and later on in 2023, early in February, it was discovered again that the breast cancer was reoccurred. And as per reoccurrence, we decided to come to Apollo Hospital. And we came here on 17th of April 2023. We met with the Dr. Anil, surgeon oncologist, and he treated him. All investigation was done, and later on it was discovered really that it was breast cancer, and it was metastatic.
I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Apollo Hospital, Bangalore. Now, Apollo being a tertiary care center, we get patients from many international countries. So this particular patient, Lucy, is from Tanzania. She was diagnosed with cancer of one breast long before, in 2017-18, for which she had taken treatment there. And now the suspicion was that she has developed cancer of the other breast. So when she came to us initially, the suspicion was that the cancer is confined to the breast. But when we did the PET scan, we found that the disease was much more extensive than what it was initially thought of. The cancer was not just in the breast, it was there in the bones, it was there in the lungs, and it was there in the liver. Initially, this came as a shock to the patient. But as doctors, we look at options even when the cancer is metastatic. Very often, metastatic cases are thought to be hopeless. But when we evaluate further, we do get options for treatment which give not only treatment options, the disease can be in remission for a long period of time. So to look at these options, we did another biopsy on the patient. We found that she was hormone negative, but she was HER2 positive. This molecular profiling helps us to see what drugs will work in this particular patient. And this patient was referred to our medical oncologist, Dr. Vishwanath, to look at further options of chemotherapy.
Hello all, I am Dr. Vishwanath S, consultant medical oncologist at Apollo Hospitals in Bangalore. Today I am going to talk to you all about Mrs. Lucy, who is a very pleasant lady from Tanzania. She initially came to a surgical oncologist for treatment of her carcinoma breast. She was initially diagnosed in Tanzania in 2020, and she underwent surgery and followed by chemotherapy. And when she came in here, there was a high likelihood of suspicion. That's when our surgical oncologist went on to do a PET scan, and PET scan showed widespread disease all over, which is called stage 4 breast cancer. Most of the times we think that stage 4 breast cancer is like a death sentence. But I would like to emphasize this point that there's so much of treatment in carcinoma breast stage 4. So rightly, our surgical oncologist went on to do a biopsy, which turned out to be HER2 positive breast cancer as compared to the previous triple negative breast cancer. This has opened up options for the patient significantly. And now we started chemotherapy in combination with what is called as targeted therapy, which specifically goes and binds to the HER2 receptor and blocks it. And the patient is tolerating the treatment very well. And we are hopeful that this patient can go on to live longer, as long as probably even 8 to 10 years with this targeted therapy. That's the beauty of this repeat biopsy and doing the repeat ER, PR and HER2 status, which opens up options for the treatment. And this is the era of personalized medicine, where we can treat the patient based on the patient's biomarkers, which are specific to an individual. Thank you.
At last, we started to chemotherapy. She responded well, and right now she's going well. Treatment here is good. Everything is fine. There is a high level of care, and they take serious with their treatment. Really, we thank all doctors here in Apollo and international personnel. Yeah, really, they treat us well. We can say that we really appreciate the treatment. Thank you very much.